And welcome. Good evening. Welcome to the 7th Board of Health meeting in 2021. Today is August 17, 2021. I hope that all had a nice beginning to the week so far. A nice reminder to all to please turn off your cell phone and mute all electronic devices to avoid distractions. To acknowledge your attendance, call out the names of the board members that I see present. Please let me know if I give out your name. I have Dr. McMahon, Dr. Colette McMahon. I have Mr. John Latch, Dr. Cynthia Makatokini, Dr. Momodu on the phone, Dr. Hakam Al-Saidi. Did I leave anyone out? Thank you. At this point, I will call on others present at the meeting to please briefly introduce themselves.
Jennifer Green, Director of Cumberland County Health Department.
Smith, Administrative Assistant.
County Counsel.
Andy York, Accountant for the Health Department.
Ashley Curtis, Director.
Medical Director.
Crystal Vinson, Director of Nursing.
Cameron Morris, Public Health Educator.
Christy Rome, registered nurse with the Cmark program.
Have we missed anyone?
I think I've already indicated who I was, Sonia Council.
Yes, ma'am.
Okay.
And it's Travis Greer on, and Travis Greer is our tobacco coordinator.
Thank you very much. You are all welcome. And thank you for taking time out of your busy schedules to attend this meeting. Can we please pause briefly for a moment to relax and unwind and bring awareness to the present? Thank you. Please take a look at the agenda for today's meeting on page 1 of your packets. May I have the first motion to approve the agenda, please?
Can I make a motion to approve the agenda?
I second.
All in favor?
All in favor.
Aye.
Thank you. I believe you all had the opportunity to go through the last minute's meeting from June 15, 2021. You have it on pages 2 through 4 of the packet. Do we have any corrections to be made? If there are no correction or corrections, may I please have the motion to approve?
I make a motion to approve. Can I second it?
All in favor?
Aye.
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 Thank you. Next on the agenda is the approval of the Board of Health meeting in September 2020. There are 2 months in the year, July and September, when board members do not have to meet. But for next month, there's a need to meet so that board members could vote on and approve the fee schedule for flu vaccines and any other urgent matters arising, such as the community health assessment. Dr. Green, do you want to expand on that for us, please?
Thank you, Dr. Ojo. So what we typically run into in the fall, and what we ran into last year, is that our flu fees are not ready for approval in August, and our next board meeting is not until October, and so until mid-October. And so by that time, because of the gap, there's typically a delay in us being able to offer flu vaccine. Or what we had to do last year was call a special meeting to get our flus approved in late September. And so we are trying to at least instead of calling a special meeting, go ahead and get that on your calendars now. And so that we don't have to sort of scramble to get that approved or delay approval in time to get that fee schedule. If it turns out that our fee schedule is still not ready in late September, then we will communicate that back to you. But what happened last year is that we had to call the special meeting. So that's one reason. The second is today you're going to hear some preliminary results of our community health assessment. We also want to make sure the public has an opportunity to weigh in on those preliminary results and provide feedback. That's an accreditation requirement for us. And if we wait till October, it pushes back our timeline just a bit because we need to be able to incorporate the results of that feedback into our report. And then in addition, Fort Bragg has completed is close to finishing their health assessment and would like to share some data and results of their health assessment so that we can include that in our reporting of the Cumberland County Community Health Assessment. So for those reasons, we propose that there be a brief September Board of Health meeting so we can review those two items. It probably will not be as lengthy as our normal meeting, but just a brief meeting to address those two items.
Okay, thank you, Dr. Green. Any questions for Dr. Green?
This is Sam Fleshman. I'm certainly fine with that. I'm just curious about the setting of the flu fees or the fee schedule. Why can't it be done further in advance than that? I mean, what is it that makes that harder to set ahead of time?
Yeah, so that's a great question. So we don't have them from Medicaid yet. So we don't get our health department fees from Medicaid, and we tried very hard to make sure that we had it for August, but they're just not available yet. And so last year what happened is we got them in September, but not until late September. And so that's why we couldn't approve them in advance. Well, that's why we couldn't approve them this month, I'll say.
Okay, whatever you want to work it to make it work for you is fine with me. So.
Yeah, we're trying to, last year after we had to call the special meeting, we were trying to think of a way to make sure that we were being good stewards of your time, of everyone's time, but not, in trying to get them done earlier. So we're kind of in this odd position, but if it turns out that it's too late or in the month, then we will just push it to October if we need to.
I'm certainly supportive of whatever we need to do to make it work. So.
Thank you, Dr. Fleshman. Anyone else with a question?
This is Dr. Kearney. I'm supportive as well as to whatever's best. What is the timeline? I heard you say that you could push into October, so you have a window in which this needs to be accomplished?
Well, so we'd like to ideally be able to start flu clinics in October. So what we did last year, so the Board of Health meeting typically doesn't come until mid to late weeks of the month. And so if we push the flu fee approval until October, that really means we won't be able to start flu clinics until very late October, early November. And so what we'd like to do is as soon as we receive flu from the state, be ready to roll and not have to have flu on the shelf but not be able to administer because we're waiting on a fee approval. So, and we don't always know the exact timing of the shipments. I probably bug our staff a little bit too much about when the flu shipment is coming, but we don't have the exact time. So we want to make sure we have our ducks in a row administratively so that when flu arrives, we're ready to roll.
I see. And like I had mentioned, I am supportive in whatever decision's made, and September is fine for me if we need to meet.
Thank you, Dr. Makatokini. Anybody else? If we are all in support, may I have a motion to approve, please?
McMahon, I make a motion to have a meeting in September.
Thank you. Second?
I second the motion to approve.
Thank you. All in favor?
Aye.
Aye.
We'll keep it short. We'll keep it short, I promise.
So we will have a board meeting on September 21, 2021. Please make a note of that. Thank you. Moving on to item 3 on the agenda. The floor is open for public comment, please.
We did not have anybody planned for public comment.
Thank you. We'll close that floor at this time for public comment. May I please call on Mrs. Candy York to please present the financial reports on pages 5 through 10 in your packet? Mrs. Candy York.
Good evening. Yes, beginning in your packet on page 5 is your monthly financial reports. First report on page 5 is your statement of revenues and expenditures for the month closing July 31st, 2021. At the close of the month, our revenues had exceeded our expenditures by $60,803.48. On page 6 is your expenditures by program. This is broken down by each program and the amount that had been expended throughout the month of July 30 of 2021. On page 7 begins the revenue report. You'll see that we've not recognized any state and federal allocations or grants. Of course, those are always, we draw down the dollars the month following the expense was incurred. We won't see any revenue collection until in August for those types of revenues. On page 8 is your Medicaid and Fee Earnings, followed by your fund balance and county funds allocated. On page 9, it's the accounts receivable report, broken down by program and payer source. And then finally on page 10 is a private pay, self-pay accounts receivable, broken down by program and aging. And I'll answer any questions that you may have about any of the reports for the month.
Thank you, Mrs. York. Any comments or questions for Mrs. York on the financial report? Thank you, Mrs. York. Can I please call on Mr. Travis Gray for an update on tobacco? Mr. Gray.
Travis, are you able to hear us? You're unmuted, but we cannot hear you.
Hey, Dr. Green, just testing if you can hear me now.
Yes, we can hear you now. Great.
All right, wonderful. Let's get started. Yes, thank you for having me, Board of Health. I'm here this evening to give you an update regarding what holds with the state of North Carolina and the Jewel Labs lawsuit. As many of you know, North Carolina claims to fame being the first in flight. And if you've ever been out to Jockey's Ridge, North Carolina, you can see why that flight could take place there. But another new claim to opportunity or fame that North Carolina now has is we are the first to sue Jewel Labs, and we are the first to settle and win a settlement with an e-cigarette company. And so back a little over a year ago, in October 2020, our Attorney General, Josh Stein, issued his statement and statement of them suing Jewel and the justification for that. So next slide. And as mentioned, we received this settlement in July, actually. And it's a sum of $40 million over the next 5 years, and I'll overview that with you shortly. And why this is very important to the youth vaping and tobacco epidemic is I have on the next slide a few graphs to show you why funding is vital. And, we all realize that being in public health and public service, that funding is key to fighting any type of pandemic, epidemic. This here, what you see is since 2001 to 2019, high school tobacco use rate, all tobacco products. You see the curve turning down. I'm kind of giving you a story behind the curve here. Tobacco use rate has been going down since 2001 to 2011. We have a decade there of kind of a downward curve trend of tobacco use. But then you see an uptick and a kind of a flattening of the curve. On the next slide, you'll see another justification, the story behind why that curve is flattening and rising is because the introduction and emergence of youth and vaping and the uptick of vaping products being on the market and the product of Juul coming on the market as well. And to overlay another data point on this, you'll see on the next slide funding. So in since 2001, North Carolina has received approximately $150 million per year from the Tobacco Master Settlement Agreement, which took place back in the 90s. And with that Master Settlement Agreement money in the early 2000s, they established a Health and Wellness Trust Fund. You see that fund received $6.2 million and peaked out close to $18.3 million to prevent tobacco use and cessation services. So in 2013, that Health and Wellness Trust Fund was zeroed out there. You see in 2013. So you see synonymous there, the emergence of e-cigarette use and the uptick of overall tobacco use. So funding is very key to what we're doing. So, and we are very excited to see that funding come down to the local level. So on the next slides there, you can, so next one, please. What that takes place is the provisions. Year one, $13 million. That is already kind of paid and dropped down into North Carolina. The finance committees at the legislature and so forth, they're kind of hashing that out of disseminating that and working out who's going to manage that money. And from what I've heard latest is the Tobacco Prevention and Control Branch will be managing those funds and disseminate them and so on. So we, as in years past, in 2017, 2018, the legislature did put prevention dollars in the budget, a couple millions, and we were able to make some minimal progress towards vape prevention. And so we highly anticipate more dollars, 13 million, 8 million, 40 million overall will make a significant downward trend in the tobacco use curve among high school students and young people. So what are the provisions in this? We're not only getting money on the next slide that you'll see to fight and put prevention programs in place and offer cessation services, but it also outlines how Juul labs and their business can conduct. So how they must behave. You see those conduct provisions on your screen. No direct marketing to any youth and young adults under age 21. No direct target marketing on social media, no claims of health effects and it being a cessation type product and aiding people to quit and so forth. On the next slide, there's more conduct provisions there as well, restricting online age sales and so forth, make it harder for kids to purchase these products online, especially if you're underage. So a lot of good things there, changing the tactics and the behavior of what may have got us in this youth vaping epidemic. So another thing on the next slide is a document depository. Okay, so there's going to be a website created where all the X files or all the document files that Juul Labs have will be deposited upon a website. And if you're familiar with, on the next slide, the University of California, San Francisco, they have the tobacco industry files listed there. If you ever have some downtime and just want to look at that, this is what I pulled up. All the meeting files and from the master settlement agreement. They created a depository, just like Jules going to have to do, and what we're going to have to do here in North Carolina, so we can everybody can have access to those documents there. So you see there's some sponsored program by Winston Cup there on the Fort Bragg Commissary, and there's many more interesting things on that website as well. So that is to come. Next slide. So if there's any other subsequent lawsuits, it is believed that, North Carolina will receive those provisions and they will apply in North Carolina as well. So if another state sues Jewel and they succeed, I'm not quite sure how that exactly is going to work out, reading that fine print, so you will. And finally, another thing as far as funding goes with youth tobacco prevention, there was a House Bill 567 introduced. The Youth End Act is ending and preventing and offering cessation services to reduce youth tobacco use. You can take a look at that if you've not already. It's, from what I'm hearing, is unlikely that this will be included in the state budget, since it's a dollar amount of $17 million. Since we've received this Jewel settlement lawsuit, that will likely be all the funding we receive to do this type of work in North Carolina, but it is not out of the question for sure. So I welcome any questions or thoughts, and thank you for having me this evening.
Thank you very much, Mr. Greer.
I had a question for Mr. Greer, if he can answer it. This is Dr. Fleischman. Thank you for that, and that's wonderful. I wanted to know, you made the settlements that were made by, R.J. Reynolds, those tobacco buyers, and the funding, and then the current funding that's going to the state legislature. Is there anything in the legislature that really binds them to using that money for tobacco prevention or public health? You said that budget was zeroed out. That wasn't for tobacco prevention that it got zeroed out. I think the legislature did they take those funds, or what happened?
Yeah, good question. We are still receiving master settlement agreement money each year, and that there are no stipulations here in North Carolina of what that money has to be earmarked for tobacco prevention and control. So that usually just gets deposited in the general fund, but each year the North Carolina Alliance for Health, our tobacco branch, we kind of advocate and put budget requests before that to have that money for prevention services and so forth. But that master settlement agreement money from the tobacco industry is not guaranteed to go towards tobacco prevention and control. Now, there are stipulations in this Jewel settlement lawsuit that it must be used and put towards prevention dollars, because I think lessons were learned back in from when that took place, that those stipulations weren't put in place from the onset of the master settlement agreement, So
the new settlement does dictate that so much of that money has to be used for tobacco prevention?
Correct. Yeah. Yes, sir.
Is it all of it, or just a percentage, or can you be more specific?
I believe it's the latest I've heard when the tobacco prevention control branch is here with us. It's going to be all of it. It's going to be all 40 million coming down. So.
Well, thank you for that. I appreciate the clarification.
Yes, sir.
Thank you very much, Mr. Greer. That was very informative. Anybody else have any questions for him? Thank you. Moving on, I will call on Mrs. Christy Rome to update us on the care management for at-risk children program. The Cmark program is an early childhood program that focuses on improving healthcare outcomes for young children, whereby care managers coordinate services with medical providers to ensure appropriate health and medical care. They also assist with developmental and social support to increase the quality of care provided and decrease costs. Mrs. Christy Rome, please.
Yes, hi. Hi, good morning, good evening, I'm sorry. Good evening, everyone. My name is Christy Rome. I am a public health nurse and one of the care managers for the Cmark program. I have spent the last 15 years of my nursing career with the Cumberland County Department of Public Health, and it has truly been an honor and a privilege to serve the citizens of Cumberland County. And I am here this evening to share some information with you about the Cmark program. What is Cmark? It is the care management for at-risk children. It is a state of North Carolina Medicaid program for children ages 0 to 5 years old. This is an early childhood program that offers a set of care management or care coordination services for North Carolina's young pediatric population. The local health departments across the state have been providing services to at-risk children since 1986. The name of the program may have changed a few times throughout the years, but the primary focus remains the same, and that is to help improve the health outcomes for young children. One aim of the program is better care delivery and to make healthcare more person-centered, coordinated, and accessible. And one of the goal is to ensure appropriate access to care and promote parent and family engagement in care. And the program focuses on access to primary care provider, well child check, immunizations, and preventive dental health services. And another aim is to improve the health of the children through this prevention and preventative measures, better treatment of chronic conditions, and better behavioral health care, and working collaboratively with community partners. There is an abundance of guidance and information provided to educate parents and guardians. We emphasize that underutilization of well child visits are missed opportunities to identify physical, developmental, and behavioral concerns, many of which can be managed or treated. The care managers do a follow-up contact after an ED visit to assess how the patient is doing, if they have the medication that they need, and encourage them to follow up with their primary care provider if it is recommended. And the care managers also provide transitional care. Transitional care is designed to ensure coordination and continuity of healthcare after a patient is discharged from the hospital. After discharge, we strongly encourage the parents and the guardians to follow up with their primary care provider or the specialist. The nurses in this program complete the medication reconciliation after a patient is discharged. This process involves identifying the most accurate list of medications that the patient is taking and compare that to the discharge record to ensure that there is no discrepancy. There are children who are on ADHD medication, and we also monitor that. We remind the parents or guardians about the importance of adhering to medication regimen as instructed and to keep all follow-up appointments. We have babies who are in the NICU. We closely follow these babies. We talk to the parents, to the guardians before the baby is discharged to ensure that there is a primary care provider already in place and that the baby's first appointment with a pediatrician is already scheduled before they are discharged. And these are just some of the objectives and interventions that we do to ensure coordinated and accessible health care for the children. And the Cmark program continues to identify key opportunities for improving patient experience and outcome. The Cmark care managers spend a great deal of their time collaborating and coordinating services with the primary care providers, with hospitals, specialists, therapists, and other community agencies. The care managers often act as liaison between the providers and the parents to ensure that there is that continuity of care. And families are connected to various community programs and resources to help address their unique needs and concerns. And what does it cost? I know I have a slide for that. As I mentioned earlier, Cmark is a North Carolina Medicaid program. The services are free to all who are eligible. The local health department gets reimbursed through per member per month or PMPM fee, which is $4.56 per child. This program is not only for children with Medicaid. Services are also provided to children without insurance or those with private insurance. We have patients who have TRICARE or CHAMPVA, which is a civilian health and medical program of the Department of Veterans Affairs. The Child and the Youth Branch provides funds, which is $50,573 per year for the services provided to non-Medicaid patients. During the last fiscal year, 441 non-Medicaid children received Cmark services in Cumberland County. As of yesterday, we have 704 children enrolled in the Cmark program in Cumberland County. And who is eligible to receive the Cmark services? And I have a slide for this one. The program's target groups include children with special healthcare needs, and it is defined as an illness that is expected to last 12 months or longer. Example is uncontrolled asthma. We also have children with terminal illness and requires 24/7 total care. We have children with global developmental needs and delays, like those with autism, cerebral palsy, Down syndrome, and extreme premature infants, and children with neonatal intensive care unit admission, and children with experience of adverse childhood events, including, but is not limited to, children in foster care. Right now, we have 140 children, foster care children that are enrolled in our Cmark program here in Cumberland County. History of abuse and neglect, caregiver unable to meet the infant's health and safety needs or neglect. Parent has history of parental rights termination, parental caregiver, household substance abuse, neonatal exposure to substances, CPS plan of safe care, substance affected infant, child exposed to family domestic violence, unsafe where the child lives, and environmental hazards, incarcerated family or household member, parent or guardian suffers from depression or other mental health condition, maternal postpartum depression, homeless or living in a shelter, and unstable housing situation. So who provides Cmark services in Cumberland County? The Cmark team here in Cumberland County is comprised of 3 registered nurses, 8 social workers, and 1 processing assistant. A Cmark care manager is assigned to 5 or more of the 56 pediatric or family practices in the county. Cmark program is very, very dynamic. Care managers are always interacting with somebody, either by phone calls, home visits, clinic visits, community encounters such as WIC or DSS, and therapy places. Who can make referral to Cmark? Almost anyone can make a referral. A completed referral form is needed. Most of the referrals that we receive come from parents, medical providers, Medicaid, DSS, Social Security Administration, WIC, Head Start, CDSA, that is the Children's Developmental Services Agency, and the pre-K early in program with the school system. And now that we are in managed care, we are also receiving referrals from the prepaid health plans. And that is the a picture there, or the image of the referral form that we are using with Cmark. Just like any other program, we face challenges, but we also celebrate the many successes, big or small, that we experience with our children every day. So I would like to share with you a story about 2 of our precious little patients, twin girls born March the 24th, 2021. We received a referral from Cape Fear Valley Pediatrics on April the 29th, 2021. The clinic requested Cmark to assist the family. The parents and the twins showed up at the clinic for their 1-month well check. The parents were informed by the clinic that the girls did not have insurance according to their system, and the clinic explained to them that the services will be provided, but they have to pay out of pocket. So the parents left the clinic because they could not afford it. The parents' primary language is Spanish. Mom is proficient in English, but there are some things and concepts that she did not quite understand. So I contacted mom that same day, that afternoon, and talked to her a little bit about the situation. I explained to her who I was and the Cmark program and offered to assist the family. She was not sure if the Medicaid application was completed while they were still in the hospital. Mom agreed to meet for me to meet her at her home on a home visit the next day. So April the 30th, I met with Mom in their home. We contacted DSS and verified the status of application. We found out that the application was submitted but was incomplete. I advised Mom to submit the missing document as soon as possible. And then we contacted the child health clinic here at the health department and explained to them the situation. And the appointment was scheduled for the 3rd of May, which was the following Monday. Mom mentioned that one of the girls was diagnosed with heart murmur, and both of the girls were experiencing GERD, gastroesophageal reflux. The following Monday, the appointment was kept at the child health clinic, and the parents also personally submitted a form for Medicaid application to DSS. Medicaid was approved about 10 days later. On May the 17th, one of the girls developed high fever and was taken to the emergency room and was later admitted. She was diagnosed with UTI and vesicoureteral reflux. And for non-medical folks, that is like a condition in which the urine moves backward from the bladder to the kidneys. So she stayed in the hospital for 2 days for a monitoring. The hospital doctor advised the parents to go back to their primary care provider, to the pediatrician, so she can be referred to a pediatric urologist. So she returned to Cape Fear Valley Pediatrics for follow-up on May the 25th and was referred to Duke Pediatric Urology. She was seen by the urologist on June the 2nd. All the tests were completed, and she is currently on prophylactic medication and antibiotic that she needs to take. She needs to take for the whole year. And the other twin also had some abnormal neuroreflexes that were found during the well child check and was referred to a neurologist. All the neuro tests came back normal, and she is doing very well. Both girls are thriving. I met with them at the clinic a week ago when they had a 4 months well check, and one weighed 16 pounds, the other 15 pounds, and they're very happy babies. No repeat ED visit, no repeat hospitalization, and they are well linked to their primary care provider. A parent once told me, "Thank you for being on my child's team." I never really thought of it that way in the past, but it changed the way I look at my caseload of patients. I no longer see these children as cases that need to be managed, but there are children who need a solid team that advocates for them. Sometimes people ask, what do care managers do? What do case managers do? And it can be difficult to explain. It is like putting puzzle together, and every piece is important. Sometimes you may have 5 pieces to the puzzle, sometimes 100, and it can get very challenging. But once you see the outcome, it can be very rewarding. And I do believe what CDC says, that a child's health is the public's health. So the Cmark program operates under the premise that the children's health and well-being determine the health of the next generation and can help predict future public health challenges for the families, for the communities, and for the healthcare system as a whole. And we, the Cmark team here in Cumberland County, we consider it an honor and a privilege to be a part of this children's team and help them in any way we can so they can live healthy lives and reach their full potential. So that is Cmark in a nutshell. Thank you so much for giving me the opportunity to share this information with you. And does anyone have any question?
Thank you, Mrs. Rome. Any questions, comments on the Cmark program?
I don't have any questions, but it sounds like a fantastic program. Great need.
Thank you. And have a good evening.
Yeah, and I would like to congratulate Ms. Christy Rome.
Yes.
And thank you for sharing the stories with us. It was touching, and it's nice to hear how services impact the lives of others. Thank you.
Yes, it is. It is an honor to serve these children in our county.
Thank you, Mrs. Rome.
All right, thank you, and have a good evening.
Thank you.
Can I please call on Mrs. Tamara to please brief us on the community health assessment and review of preliminary data, please?
Good evening, and thank you all for having me. As she said, my name is Tamara Morris, and I'm a public health educator here at the Health Department. And I'm here to give you information about our community health needs assessment and our status thus far in this process. We have completed the data collection portion of this process. Our goal was to get 1,000 surveys from residents, and we collected 1,545 surveys, as well as conducting 2 focus groups with specialized populations this year. We are on the regional schedule with Health ENC and other counties within our region so that we can minimize duplication of efforts and combine those efforts with local hospitals and other community-based organizations. So we will be conducting this assessment every 3 years now. The data is currently being analyzed by the Health ENC team, and they expect to have county-specific findings to us in October, which is why this report is just preliminary. What we found with the preliminary results is that most respondents agree that there is good health care in Cumberland County. Their top 3 health behaviors that residents were felt they needed more information about were mental health or behavioral health, eating well and nutrition services, and crime prevention. And then I just also wanted to highlight the 3 issues that residents responded saying were having the largest impact on quality of life in our area. And most respondents' opinions on those top 3 were income and poverty levels, violent crime to include murder and assault and theft, as well as drugs and alcohol or substance abuse misuse. And so those rankings were not particularly aligned with the baseline, which you'll see on that chart there on the screen. The baseline for all of the counties who were participants in the needs assessment process. And I prioritized ours here on the chart to show Cumberland County's rankings individually. These bars represent the percentage of total responses by questions for those who indicated that they reside in Cumberland County. And the baseline ticks are just their comparative purposes for sorting the responses for those questions themselves. We do have preliminary data for all of the questions that were listed on the survey, but I just wanted to highlight the top 3 health indicators that were listed because that's how we develop our community health improvement plan. Also, most residents reported getting their health-related information from doctors or nurses or the internet were their top 2 response choices, which was nearly congruent with the county baseline ticks and other county responses. They also reported, we had questions this year on climate change and global warming, as well as their response to COVID-19 and how they were affected by it. And folks had marked about their COVID-19 responses, mostly that they were impacted by being significantly stressed or experiencing anxiety, having social isolation or mental or behavioral health impacts. And these were either in line with or exceeding the baseline ticks. Vaccine hesitancy varied across the surveys that were collected, with most respondents having no concerns about getting the vaccine to just being worried about its side effects. That's where we saw most of the response for that question. But we also had a difference in demographic rankings this year, so that may have made a considerable difference. The demographic rankings that you see on the screen are the quick statistics, and so this is just showing their identified gender, race and ethnicity, and their age range. There was a lot of lower range of the 20 to 24 participant responses that we saw, and so we made a greater effort to get folks in that age range to submit responses and participate in the needs assessment process towards the end of the collection time. But we still saw that there was not as significant a participation from that age range, and we'll take that into consideration in our next needs assessment process. Most of the responses were from individuals who were employed full-time or retired, and we think that that may make a significant difference as well, but we will find out when we get our final report in October. And so that's just the preliminary information that I wanted to share thus far. We are extremely thankful to everyone who participated in the survey, shared it, had surveys turned in from their local organizations where you work, or socialize, or, you know, with faith-based groups. We did see an improvement in getting hand surveys turned into us from local libraries or our veteran services, encouraging participation and sharing information about the process. So that is greatly appreciated. We will meet with Health ENC to discuss next steps for the Community Health Needs Assessment in September. And they will, at that time, hopefully give us a concrete date of October when we'll receive our analyzed results. And that is all I have at this time. If anyone has any questions, I'll be happy to answer.
Thank you, Mrs. Morris.
And Dr. Ojo, if I can, I want to cut two things. Because we knew that we would have probably an underrepresentation from 18 to 24-year-olds, one of the focus groups that Tamara mentioned was done with college students to try to capture some of the nuance of how they are impacted by health in our county. So that was one thing I just wanted to remind the board, that in some of our interactions, we tried to do focus groups with those populations we knew would be underrepresented. And the same thing, Hispanic individuals were underrepresented on the survey, so we did a focus group there as well in Spanish. And then one of the reasons that we wanted to do the September board meeting is we need to give the public an opportunity to provide feedback on the survey, and then Tamara will be able to share that if we have any public comment to Health ENC when they meet for their next meeting. So just wanted to highlight that point.
Thank you, Dr. Green. Any questions, comments, please? I will now call on Dr. Jennifer Green to please present the director's report.
Good afternoon, everyone. We'll start. We have several kind of updates to provide you. We'll start with COVID. So this is a map, and when I was putting together the slides for our meeting today, I was looking back at our June data, and we had a much different picture when we had our June meeting. All of our metrics were moving in the right direction. Our cases were declining. Our hospitalizations were declining. We had fewer deaths on the screen, and we are in a different spot than we were than the last time we got to meet with you in June. So we currently have, in the last 14 days, more than 2,200 cases. In the last week, we've had more than 1,000 cases. Our case positivity rate is up at about 16%. When we met in June, it was just above 5%. 348 deaths. That's an indicator that we know lags behind in terms of the data collection. So we likely have more deaths than that. That's up, I believe, about 30 people since we met in June, just for context. So really sharp increases. The state has switched to utilizing the CDC's data tracker instead of the county alert system that you've seen previously. So this is a screenshot from the data tracker, and you can see, I think every county except for one is in red, which means high transmission. So we are not, again, a pretty different picture than we were last month or in June. On the next slide, you can see our testing data. We've seen an increase in the number of people getting tested over the last several weeks. That's not a surprise, as more people are getting tested, more people are testing positive, more contacts for sure, as we have the very contagious Delta variant. So that number continues to go up. The black line is the case positivity rate, and the bars indicate each week since January the number of tests that were performed. So we're definitely seeing an uptick in the number of people that are being tested. And if you drive around to kind of some of the popular testing places in the county, you can see lines, whereas those parking lots used to be empty over the summer. Now those are picked back up again. On the next slide, I have a little bit of an update for our testing. This is already outdated from this morning when we put the slides together. We did have at-home test kits available for pickup at the health department. We started that a couple of weeks ago, and we are wiped out. So we do not currently have any test kits available. You could do so. You didn't need an appointment. You could just come pick up an at-home test kit. It's a PCR test, and you can take that home with you for use now or use later. We have ordered more, but just like many other testing supplies, they are on back order. So we hopefully will have those back in supply next week. We get those for free from the state health department. We've taken those out. Our health ed team has taken those out to community events. The public can walk in and pick those up. We've shared some with emergency management to make sure that our first responders have access to test kits, and other community-based organizations around the county. So we are out as of this afternoon, but are working quickly on resupply of those. We are relaunching testing by the health department staff, and by that I mean we're going to be using our state vendor OptumServe. On Monday coming up, we will resume testing for COVID on Monday, Wednesdays, and Fridays from 9 a.m. to 4 p.m. at the health department. It will be PCR testing. You don't need an appointment. You don't need insurance. You can just show up. We are going to start drive-through testing to try to get an assessment of volume and what that's going to look like in our parking lot. We're not quite sure. And then we will physically take people walking up if the space allows for that. We need a little more space to have a walk-up side and a drive-through side at the same time. So we will kind of assess that, but we're going to start with drive-through first. COVID vaccine clinics, we did, you might, as you recall, in our June meeting, we continued to do a number of outreach clinics. As of June 30th, we ended our operations of mass vaccinations at the Crown and really shifted to doing outreach clinics. We vaccinate every day at the health department, Monday through Friday, 9 a.m. to 4 p.m. You don't need an appointment. You can just walk right in. And we've really seen in the last few days an uptick, or a few weeks, an uptick in the people wanting vaccines. So that's good. Still nowhere close to where I'd say where we need to be in getting people vaccinated across the county. But we do have that available. We have J&J and Pfizer available for individuals. Last month in July, we launched vaccinations at the library. So our library director, Miss Faith Phillips, really let us come into her space, and we worked with our state vendor to have vaccination clinics at the libraries on a rotating schedule throughout the month of July and August. And so most weekends there were, we kind of started them. So every weekend there's probably 1 or 2 libraries that are vaccinating with either a first dose or second dose. So we're really excited to do that, and that will go through the end of this month. We also have a number of kind of smaller churches where we're doing outreach clinics and testing for vaccines. So that has been a great partnership. Our team was at Fayetteville Tech today, and then we'll be at Methodist here next week, vaccinating their students as they get ready to come back to school. We're working with the city of Fayetteville, PwC, Cumberland Health Net. We'll do a vaccination clinic in the courthouse here next week to make sure anybody that comes into the courthouse, we know it's a high traffic area, can have an opportunity to get vaccinated. So we'll have a couple of vaccine clinics there. And then there is a campaign at the state level working with a local partner called Healthier Together. And they have really helped us to connect individuals, connect community-based organizations with vaccine events. And so they'll reach out to us and say, we have X community partner that wants to do a vaccine event. Are you able to help provide vaccine to that event? or work with our state vendor. So for example, last Saturday, we collaborated and the state vendor was able to provide vaccines at the transit center last Saturday. So lots of opportunities to get people vaccinated, and we probably get a new request every day for a vaccine clinic. So we'll continue to handle those as best we can. In terms of our vaccination rates, the state dashboard now includes data from individuals that are from the DOD, Fort Bragg, Federal Bureau of Prisons, Indian Health Services, and the VA on their summary dashboard data. The demographic dashboard data, just because the data fields don't match up, still doesn't include those federal resources or vaccines distributed by those federal resources, but our summary data does. So overall population, if we including those that are not eligible yet to get vaccinated, 48% of our total population vaccinated. If we just look at our 12 and up, 58%. If we look at those 18 and over, we've got 61%. And then our 85 plus crowd, 65 plus crowd really showed up to get vaccinated, and we have 86% of those individuals vaccinated. We have thought very thoughtfully about equity from the very beginning and trying to make sure that we are doing that in a way that was not just at the Crown, but in these neighborhood local clinics. And so we've done quite a bit of that, as you saw on the previous slide and previous presentations. About a little over a third, 37% of our shots administered, and by our, I mean the county as a whole, so not just the health department, have gone to those that are African American. We make up about 41% of the population. 7% have gone to those that are Hispanic, 38% to those that are 18 to 49. So that's an area where we really lag behind in our young people getting vaccinated. So we've tried some really creative ideas. You might remember in June, we were talking about going down to Fourth Fridays to get people vaccinated, and trying different ideas to get our young people engaged. We've done some work with our Millennial Council, and then also again with Fayetteville Tech and Methodist to get their students encouraged to get vaccinated. And then most of our vaccines have gone 60% to those that are female. So the big news of the weekend, of course, was about our additional doses for those that are immune compromised. And we are getting ready to roll that out. We are working on those standing orders as well. We received the state level standing orders this morning. And so the CDC endorsed the additional dose of vaccines for those that are moderately or severely compromised after they received either the Pfizer or the Moderna vaccine. So still no additional dose for those that have received the data. More data is needed. And the guidelines that we have published on our website in accordance with CDC guidelines is that we need, if you're going to get that third additional dose, if you're immune compromised, it needs to be at least 28 days after your initial completed series. So if you completed Moderna or Pfizer for your second dose, you need to wait at least 28 days for you to get that third dose. So we've already had people calling, and we're trying to get those individuals to be able to get seen as quickly as possible. We do, on the next slide, want you to get the same vaccine available. So if you got Moderna and Pfizer, or Moderna the first time and the second time, we want you to get that time. We're out of Moderna at the health department. We are working on ordering more, but we are out. So we are, there is an exception. If something is not available for you, you can administer we could administer Pfizer to you, but we prefer that if you get the same vaccine as you initially had. And again, no booster shots for anybody else yet. We are asking people to self-attest to their status, so we're not requiring you to get a doctor's note or for your provider to call us. We really are going on and hoping that people will be good stewards of the resources that we have, and that you are going to just be asked to self-report that you are immune compromised, but no proof is needed on our side. And that's in accordance with the guidance we've received from the state. I won't read to you the list, but this is from the CDC, the list of folks that we would consider to be on the list for those that are immune compromised, and they would meet that requirement. And this is not a limit. This is not every condition, but just the guidelines so far that the CDC has issued for those that are immune compromised. So before I talk a little bit about operational changes, pause there and see if there are any questions about COVID. We're going to hit a little bit on COVID and the operational changes, but I want to pause there to see if there are any questions from the board.
Maybe Dr. Fleischman, I have like a lot of colleagues asking me about mandating vaccine your employees. I didn't know how the hospital or how the handled it.
Yeah, I'm going to talk, Dr. Fleischman, I'm putting on the spot. If you want to talk about the hospital, I can talk a little bit about where we're going in just a moment when you're done.
Thank you.
You want me to answer first? I'm glad to do it. Yeah. So just a backdrop. I mean, you know, we have come out and we've mandated that our employees have to be have to have their second shot if they're getting 2 doses to be by October 1st. So they have to have their second shot by October 1st, or it is essentially a condition of employment at the health system at this point. There are medical and religious exemptions around that, but we will consider around it. It certainly was a difficult decision for the health system, but based on what we're seeing and what's going on right now, we thought it was, and what the science is telling us, we thought it was the right decision to make. I think currently 65 to 65% of our employees are vaccinated. And we understand this has been difficult. We had town halls, lots of discussion, but the science is overwhelming about the safety and efficacy of these vaccines. We are, you know, our health system and all health systems across the state are getting tremendously strained with the COVID surge going on with the Delta variant. Our ICUs are full of younger, healthier people on ventilators that are not surviving. We are overrun in the ICU. I mean, we're having holds in the ICUs. We're having holds in our ED, and honestly, it's really difficult right now. And it's difficult across all the health systems across the state. There's nowhere to transfer anyone, and we're doing the best we can. Our team is very resilient and working extremely hard. But seeing this and with over 90% of the people in the ICUs on ventilators, 95%, all these people are unvaccinated individuals. We have very few individuals that are vaccinated that are getting into the ICU or going on ventilators or dying. We are having an uptick of hospitalizations. Probably 10% of our hospitalized patients in our census now is at 130 of COVID patients today. 130. We were at the end of June. We were down to almost 15 to 19 patients, and now we have 130. So the surge is real, and it really is the unvaccinated population, a younger, healthier population that is being severely affected. I can't tell you how real this is and how serious it is. It was this kind of information and what's going on in our own health system that we felt like we had to make these decisions for our healthcare team, for our patients in our community, in our region as being healthcare providers to make that decision. We don't take it lightly. Mandating anything in our culture and our society is difficult, and I liken it to the last time we mandated something like this. I think about time efforts and drafts, but I think that's where we're at as far as what we got to do for not only our individuals who could be affected, but for our community and our region. So, but that just to give you a comment about, but that's what we're doing right now as far as mandatory vaccinations go. So, yeah.
Thank you, Dr. Fleischman. Yeah, it's been your staff send me our death data, and it is it is hard to look at, I think, sometimes because, one, they spend it much more frequently than they did back in June, in July. And whenever we have an individual pass away, and they typically will put, their age, and they're getting younger in their 20s and their 30s and their 40s. We still have the older patients that, of course, that are dying too. And then if they know the status of their vaccination status, time guards, they're unvaccinated. And so it is, I thank you to your team for their hard work. It is just, it's a tight time, and we are doing everything we can to urge the public to get vaccinated. So on our side, we just for a little bit.
Madam President,
We are.
this is Sonia, and I'm sorry that I have to leave because I have to give a report. But so far, I enjoy everything I heard, so I'm gonna have to be excused because I have to give a report. I'm on duty.
Yes, ma'am. Thank you.
Okay, thank you. Bye-bye.
Dr. Green, I wanted to add something to what Dr. Fletcher said. Many of the UNC Health hospitals or affiliated UNC Health hospitals are also mandating the vaccination, and in Lumberton at UNC Health Southeastern, it is also being mandated as well as part of the expected of being employed at the health system. And I agree it's the right direction to go. And I believe it's the only way that we're going to get a handle on this whole entire pandemic that's really wreaking havoc on everybody's life. And I don't believe we're going to be able to get anywhere near to where we need to be unless more healthcare agencies and mandate and require this. Not only healthcare agencies, but other places of business mandate this so that we can get back to closer to a normal way of life.
Yes, thank you for that. So what we're working on is for context, we already mandate our staff to get other vaccinations. So, and I think that's true in every healthcare facility that I've worked in, and most local health departments, there's some requirement for vaccination. So we have done our due diligence to make sure that we are gathering policies from other local health departments that have already are a bit ahead of us and have mandated vaccines already. So we're taking the policies that they have. We are reviewing them and consulting with HR and legal right now to make sure to determine what it is that we're able to do. So that's what we spent a lot of yesterday and today and last week doing. And then making sure we're having a conversation with our county as well. So we are making sure that we are trying to make sure.
Haven't seen you lately. Hey, big guy. Haven't seen you in a while. How you been doing? Been good?
Somebody needs to mute their phone, please.
There you go.
If you are not speaking,
They will. Remember that?
there we go. Thank you. So we are reviewing our policy as well with our legal department and our county management team, and then of course the UNC School of Government actually yesterday and I believe today put out 2 codes canons about vaccine mandates and what is permissible and how you can roll that out. And APHA, the American Public Health Association, in collaboration with several other healthcare organizations, put out a statement. This was probably a couple of weeks ago about mandating the vaccines and support, and then allowing for exemptions as Cape Fear, Dr. Fleischman allowed for medical and religious exemptions. So we're reviewing those policies right now and drafting our own in collaboration with legal and what is allowable and what we can do to make sure we're in compliance with the EEOC and ADA and all of our those types of agencies. So we hope we'll have more information very soon to share with the board. And I'll pause there to see if there are questions or comments about that part.
Dr. Green, John Larch. I was wondering if I don't know if you have this now or something we could move towards the future. You had some very telling graphs in the past that sort of showed the ebbs and flows of this disease, death rates and whatnot, that had traced it right back from the beginning. And I was wondering if that's something that we could continue to see. I think that's helpful to let us know. I know it's getting worse again, but it's when you see it on the graph, I think that helps us all to understand, that, hey, all of a sudden here we are in August and it's looking like whatever it looked like last October or November when things were getting worse again. I don't know if you have anything like that tonight, but maybe just, that consistency of presenting that data, I think would be helpful.
Yeah, we absolutely can do that. And what we'll do this evening is send out the link to the graphs on our dashboard, and we'll make sure that we share that out with you, because the state has shifted a little bit the way that they're doing their data. So we can still see it. It doesn't quite look like it did back in January, but you can still see the trend data. The only data that we don't have on the state dashboard, where we don't have clear trend data for, it kind of comes out daily, is our hospitalization. You kind of get a point in time picture, and you can go back and look at any day. I think since last October, you can go back and look and see, but it doesn't put it on a nice, pretty graph for you. But we have it for cases and deaths and vaccinations as well. So we can make sure that we share that out with you. And I apologize. I was trying to, I knew we had a lengthy agenda today, so I was trying to make sure that we get the information but that we were good stewards of your time. So we'll make sure that we have that in future presentations.
Thank you.
Dr. Green, this is Dr. Kearney. And I saw in an earlier slide, there was 300 and I believe 84 deaths. Do you have data, or is there data available that delineates whether or not folks were vaccinated or unvaccinated?
That's hard. So they don't have that at the county level on the state dashboard. We get that data from Dr. Fleischman's team, and to the extent that they know it, if that person is vaccinated or not. And they've been great in giving us that information. But all 348 of our deaths didn't pass away at Cape Fear Valley. So we have their death data, but if you died in a different county or in a different hospital, or you're out of state, that gets reported to the state, of course, but we don't necessarily have the vaccination status. So we don't have that in a nice graph to show you. They have some state level data about death and vaccination, and I believe there is a state level report that just has numbers. I don't know that there are any charts or graphs, but or if it's not available yet, it is, what we hear is that it is forthcoming. So we'll make sure that we get that out to you.
Okay, thank you.
I can only tell you that in the last 2 weeks, the numbers are staggering as far as the number of deaths in July compared to August, and in the last 2 months compared to the 6 months prior. And I don't have the numbers in front of me, but they're staggering. So
if I went back and looked at our slides from this time in June, and in June we had, I think 300 and just over 300 deaths, maybe 315. So we're about plus 30 since June, the end of mid-June. So about 2 months ago, which is staggering. I mean, it is far too many. So in light of that, we have a couple of operational changes, and we wanted to make a few additional changes, but frankly, COVID has derailed us a bit. As we thought we were decreasing our numbers. We resumed our late night clinical services last week on August the 10th, and we will keep doing that. We used to do it pre-COVID twice a month, and we wanted to put that opportunity back into the public's hand, especially as we think about getting vaccinated in the evening time. So we wanted to make that service available. but wanted to make sure as we have challenges with staffing, just like every other agency, that we're making sure that we're making a good use of that time. So we had our first one last Tuesday, and we'll do it monthly on Tuesdays, on the second Tuesday of each month, at least for the time being, from 5 p.m. to 7 p.m. We have all of our clinical services available and WIC, and then our COVID vaccines also are available. Our mask policy, we never lifted it at the health department. You still have to wear a mask when you come see us. And it is County Manager Amy Cannon required in all county buildings, regardless of your vaccination status. So we continue to do that. When you come visit the health department, we continue to do screening of patients at the front of the building. And then we intended to at least allow some additional visitors into the building. This was back, we talked with our team back in May when our numbers were moving in the right direction, but we decided not to lift our visitor restriction. So right now, we only allow visitors accompanying patients who are in child health or a WIC visit that includes a child. So your parent can come with you. And we do that so we can limit the number of people in the building. We're seeing more people come back for visits in person, which is a good thing. But we still, in certain of our clinic areas, it's a tight space. And so we want to and our rooms get pretty small. And so we want to make sure that we have enough space in our clinic rooms and in our offices to allow for, as to the extent possible, for some distance and not making it overcrowded in that space. So that's where we are. We talked about mask or vaccine mandate. So we'll have an update on that policy here soon. And then the other sort of operational changes that we have Narcan kits available to the public. They can pick them up at the pharmacy downstairs. You don't need an appointment. You can just walk in and get a Narcan kit. That was through funding from the county. The county gave Alliance Health funding, and they shared some of that funding with us to purchase those kits. And then in addition, before we got our kits, a lot of those dollars went to purchasing Narcan kits for our first responders. So all of our fire stations have them, and then we can help restock them if they need it. Cape Fear CERT team, we shared with them. Roxy, we shared some with them as well. So making sure that some of our frontline folks that are seeing behavioral health will have those Narcan kits available. So we rolled that out last week or the week prior. A few strategic plan updates from us, and then and both of these are related to NC Care 360 and the priorities that the board set forth. So one of the priorities that the board set forth for us was about expanding community access to health department services, making sure that we're improving the community perception of the health department, doing more outreach activities, which we've done quite a bit with COVID, providing clinical services and WIC services off-site, making sure that we're improving access to the health department. So we've talked a little bit about increasing our hours again, making sure that that's accessible to the public. We also, our team, our senior leadership team has tasked our staff to get creative this fall with outreach clinics, and that's not just for COVID or flu, but for across our health department services. We've learned a lot from COVID, making sure we're getting those clinics out into the neighborhoods, out into the field, and to the extent that we are able to, in the middle of COVID, providing services in places that we might not normally do. So we are working on rolling those out over the next couple of months and getting kind of creative and doing some pilot. And so wanted to provide that update. The next priority that the board set was about improving our quality and efficiency of services and expanding our substance abuse and mental health services. Our strategic planning team really set forth a couple of strategies in this area. One was to make sure we're screening all of our patients for social determinants of health, and then implementing the statewide coordinated care system, NC Care 360 at the health department, and then having our social worker use that system to make referrals. And some of those are also Medicaid transformation requirements for us. So on the next slide, we are in the process of building our NC Care 360 system. And as a reminder, NC Care 360 is this statewide coordinated network to make electronic referrals for the community. And it really allows for people to have a feedback loop on whatever the referral we made. So if we referred you to WIC, can we refer a patient to WIC? What happened with that referral? So in the midst of the pandemic, they sped up the rollout and rolled that out in all 100 counties. So we are starting that process at the health department. We heard back from our state partners today, and we hope to be built by the end of the week. And then we will make tweaks and fine tune that once it is live for us. So we will go live with that this month. We've identified at least one NC Care 360 champion in each area. It's going to look a little bit different in WIC versus child health versus immunizations versus environmental health. But we have at least one NC Care 360 champion in every area that's going to help roll this out and put it together. And then we've provided a couple of training opportunities for staff as well for NC Care 360 to make sure that they're ready to go. In relation to that, we are starting to screen for social determinants of health, or will start to screen for social determinants of health. The state has designated 4 priority areas. You can see on the screen. We'll be able to screen directly in NC Care 360 or to screen on paper. Excuse me, I'm using my voice too much. So we're getting ready to roll that out as well. And our goal is to make sure we at least screen clients at least once every 30 days for their social determinants of health. And then we'll utilize NC Care 360 to connect those individuals to clients. So I'll pause there to see if there are questions about those 2 initiatives related to the strategic plan. All right, 2 other quick updates. We have our QI plan is in place, and all of our teams are in progress of working on our QI projects. Those range from doing customer satisfaction surveys in maternity and child health, maternity and our family planning clinic, to making sure that our housekeeping staff is being more efficient with cleaning rooms. So we have a range of projects that we are working on, and all of those are going live. We, again, kind of got derailed and pushed back a bit from COVID, but all of our teams are working on their QI projects, and we are working on getting our QI plan posted online if it's not already. So that's coming. That public-facing plan is available, and then we'll have a report out once we finish those QI projects. Back to school immunizations. Of course, it is the time for back to school immunizations. There is no extension this year. Last year, I believe they granted 2 extensions for children to get their back to school immunizations. Not going to happen this year. So we've been pushing all summer to get folks vaccinated. We've used some of our money that we have available to do digital ads. We've done lots of radio interviews. We're grateful to the school district. We did some coffee conversations with them that got sent out to all parents about getting vaccinated for back to school. And then we did a COVID / back to school immunization clinics at the end of July to encourage people, hey, get your back to school immunizations, but also it's time to get your COVID vaccine, and really pushing parents to get their kids fully vaccinated for COVID before they walk back in that school building. So we're excited. We hope that those efforts will bear out when we get those as kids go back to school next week. This is about the time of the year where we see an influx of people about 2 days out from school starting say, I need all my immunizations. So we know our crew back at the health department is really busy. And then the last thing I just want to put on your radar is about our Board of Health vacancies. So we've got several board members that we very much appreciate for your service, but you're running out of time, and your terms are going to expire at the end of December. So no action needed today, but just as a reminder, we'll have I believe we'll have 4 board vacancies for folks that their terms will expire in December, and we need to fill those positions. So now is the time to start thinking for who your colleagues are, community members that will want to have on the board to join us, and we'll do another reminder in our September and October meetings. But in November, December timeframe, we need to start thinking about voting on who's going to fill those board vacancies. So those are the.
Dr. Green, in line with that, I actually have two potential candidates that I would love for the board to consider. I'm happy to talk about them now, or if there was a time that you had designated for us to discuss potential candidates and for them to come to the meeting.
Yeah, so what we'll have Kelly do is send out the link for them to apply with the county for those vacancies. And then I believe what we did last year is we brought all those we sent out in advance all the packets, and then the board had a chance to review, and then we invited those candidates to come to a board meeting, which again, I'd like to do in November, December timeframe. So now is the time to start thinking about who you'd like to fill those positions. So we'll have Kelly send out the link, and if you all will help us by sharing that out widely to the public to fill those vacancies.
Okay, sounds good. Is Kelly going to send it out tonight or next week or something?
I think I have the link, Kelly. When I send out the charts and the graphs, I can put the link in there. How about that? And I'll do that this evening. That is all I have. Thank you for allowing me to do a little bit longer update today.
Thank you very much, Dr. Green. Does anyone have questions or comments for Dr. Green and any of the updates whatsoever? Next group meeting in September is
Yes, so we are going to meet in September the 21st. Yes, ma'am.
September 21st. Okay. Any other questions, comments, please, for Dr. Green? At this point, I would implore all board members to please review the attendance roster on page 11 and communicate any disparity or disparities to Ms. Kelly. Do we have any comments, please, from Board of Health members? If not, I would like to say in closing, thank you very much for attending today's meeting. Please mark your calendar for the next Board of Health meeting on Tuesday, September 21, 2021 at 6 p.m. If there is any item that you would like to be included on the next agenda, please communicate such to us ahead of time. Do I have the motion to please adjourn today's meeting?
I make a motion to adjourn.
Second.
All in favor?
Aye. Aye. Bye-bye.